Alright guys, me and study is 5 and series. We have come to another episode of learning. And what I want you got to go, all of you to know is that when you come to lecture, or when you come to schooling, or when you come to studying or learning anything, I will never stop till until I go down 6 feet. That's just so. So today we'll be talking about ampiclox bichaam. All of you that normally take ampiclox bichaam, if you don't know it, this is ampiclox bichaam for you. Look at it. So we have a lot of things to talk about the ampiclox bichaam. We have a lot to say about this ampiclox bichaam. Ampiclox bichaam is what is it called? A combination of ampicillin and cloxacillin. Let me see to it. Now this is lecture. I have to take more about something. Combination of ampicillin and cloxacillin give rise to ampiclox bichaam to all of you. And all of you all know you get. So, but some people don't still get it. They get it twisted. I mean, by taking, some people take bichaam, this ampiclox bichaam as a contraceptives. For example, this morning, earlier today, I dropped a video concerning the usage of misoprostol and antipostino either by 2 or by 10. I dropped an exclusive video about it. So today we'll still be dropping video on ampiclox bichaam, which is medically combination of ampicillin and cloxacillin. There are things you have to understand about this thing. That is what we'll be talking about. Yeah, so let's go deep down at it. Yeah, so let's look at this definition of you are going to be using this one as picture. And these are the researches that we need so far. And I'll be picking some words from there. You get the point. So first thing, they define ampiclox, but there is something very important that is confusing here. Ampiclox bichaam is a mixture of ampicillin and cloxacillin for infection during first week of life. I mean, this first week of life somehow disturbing. Are they actually saying that for the first week of life of that infection, that bacterial effect, or they are saying of the life of the person that is being infected? Are they talking about the prey, the host? Are they talking about the host or the parasite? So we have to talk about this thing. So let's go. According to them, they say it is available in conveniently small doses as a lateral or as an injection. Let's drop down there. And we are going to be asking ourselves just 2 questions. Does bichaam and ampiclox actually prevent infection? This is the first question that we ask ourselves. And then as well, we talk about how bichaam and ampiclox have to do with contraceptives or using it to some certain terminations of pregnancy. So let's talk about the first one. Does that bichaam and ampiclox actually prevent infection? That is the first thing that will be dealing with. Good. So I think we have to talk about that. And then from there we will draw a little attention to the other side, which is how we serve as contaminate pregnancy as a contraceptive. So let's actually go down to that as the ampiclox actually treat and handle infection. The ampiclox is an antibiotic medication. Okay, so we have to understand first and foremost, and then it is just the combination, as I said earlier, ampicillin and cloxacillin. I get the point. So it is commonly prescribed. That is to say, it is commonly prescribed. To treat infections. So, they are not saying that it's commonly prescribed to treat. They are saying it's commonly prescribed to treat an infection. But according to the lecture, they never actually said what kind of infection, whether it's bacteria or virus or fungi. So we have to talk about that one as well. Yes, why ampiclox can be effective in fighting certain types of bacterial infection? Yes, the same ampiclox is only active on bacterial infection. On what bacterial infection? Yes, so what we have to talk about here is that the formation of the bichaam because it is a broad spectrum from lesions of ampicillin and then cloxacillin. I get in the point. So in ampicillin there is one deadlish chemical there. In cloxacillin there is one deadlish chemical there. Trihydrate 6-amino penicillinate. That is in ampicillin. And when it comes to in cloxacillin, we have the cloxacillin what? Penicillin. This one, they are the two devilish what is it called, chemical that is there. So let's drop this thing and explain everything to the core. We have gotten that, we have known the fact that okay, well, fine, if what is it called, if you take bichaam ampiclox for the treatment of infection, it is very active, 100% active, because that is what they are actually using it for. Because it's a broad spectrum what is it called, antibiotics. When they say broad spectrum, there are things that you have to, that is to say, it works on the soft tissue layer. So if that is the case, there are some certain some certain medical case that you have to attend with what is called bichaam ampiclox. So if that is the case as well, if you must take it in your first trimester, it can hinder or trigger something very, very difficult in your body or the body of the what is going to help. So what we are trying to say in essence here, that the chemical that is involved now, something that is possible, that is a broad spectrum antibiotic that is possible to cure bacterial infection, then automatically if you must take that thing during the first trimester, remember it's broad spectrum. If you must take that thing during your first trimester of pregnancy, then you have a lot to face. A lot. You have a lot to face as a lady. Because first and foremost, you can be experiencing nausea, you can be experiencing vomiting, you can be experiencing abdominal pain. Sorry. Getting one. If case not studied, if case not taken, you will start seeing bleeding, blood, you will be bleeding anyhow. Again, this is the second thing that you have to understand about you using this as a in your first trimester pregnancy. You must not try it at all. You must not try it. Don't say, okay, let me take it to treat this particular infection. If they say it's used for infection, in another way, I can do another thing. Headache drugs or headache medication or headache medicine that you normally take does not stand that it's going to be doing anything. For instance, if you take antibiotics to treat urinary tract infection, they never say if you have PID to not assist PID. Or at the robot, if you might have injury whereby the injury is being affected by bacteria, if you must take UTI medication, urinary tract infection medication, you also attend to that injury. Are you getting it when you attend to that injury? So if you said, okay, I have this kind of bacterial infection, then you want to ahead and take bichaam ampiclox as a broad spectrum, thinking that it will help you, but it will not help you. Because remember, you are pregnant, one trimester, remember, you are in the first trimester of pregnancy, and this thing might result to many things. So you have to be careful in everything you actually partake into. Like, talk about this bichaam ampiclox. If we should drive this bichaam ampiclox to the core or treat all the class, to our best towards satisfaction, we have a lot to say. Bichaam ampiclox, when you want to recommend bichaam ampiclox, they said, please add blood tablet too. There's a reason for that, and we have to talk about that as well. So many things is actually hidden under the carpet of ampiclox, bichaam, ampicillin, and cloxacillin. So the last thing will be augmentin, ampicillin, and it's not ampicillin and cloxacillin, and clavulanic acid. Ampicillin and clavulanic acid, that is augmentin. That's our next lecture. Augmentin, this is clavulanic acid, and what is it called? Ampicillin. We will still talk about that one. So you guys should just stay tuned. We will be throwing back to back what you have to understand about this bichaam ampiclox. And for those that don't still know bichaam ampiclox, I think I have it in my store. I will show it off now. Just wait a little bit. Alright, for those of you that don't know bichaam ampiclox, this is bichaam ampiclox. This is bichaam ampiclox. Let me zoom this camera so that you will see it very well. Bichaam ampiclox. See it there? So why this one is bichaam ampiclox? Another time we'll discuss about bichaam ampiclox, because some people think that bichaam ampiclox is just a simple combination of this ampicillin and cloxacillin. So something is very something is hidden there that we have to know. Okay, so what this bichaam ampiclox and this one is bichaam ampicillin. You can see it inside. augmentin, you can see bichaam ampiclox. Are you getting the point? So this is what you have to understand for today's class. Just wait for the next video as we do. They drop it very soon concerning what augmentin. If I should forget that, make sure you remind me in the comment section that I have to paste down. I have a pictures on augmentin because this ampicillin and clavon, you can see have something in common that they have to do. So meanwhile, before I Google, if you must recommend, for an instance, if you have clavon, if you have a cloxacillin in your own store as a medical practitioner or a chemist, then if you should add it to ampicillin, you are automatically giving what bichaam ampiclox or ampiclox bichaam. Also applicable to this call it for me. Augmentin. If you should take clavonic acid and you take ampicillin, you are indirectly or directly taking this word augmentin. So that is what you have to understand. Thank you very much as we have come to the end of this class. And make sure you like, comment and share as I share many videos like this. Thank you.